friends, this is your friendly health coach Annie. How are you all doing? I hope you are taking good care of yourselves. In today's video, I am going to talk to you about vaginal birth after cesarean. If you have had a cesarean section in the past, you may be wondering whether it is possible to have a vaginal birth in subsequent pregnancies. The good news is that many women who have had a C-section can safely have a vaginal birth. If you have had a cesarean before, it does not mean you have to deliver the same way again. Many women can give birth vaginally after having a cesarean section in the past. This is called a vaginal birth after cesarean, or VBAC. Let me share my story with you. My first pregnancy was an emergency C-section. I later had 2 more pregnancies after the emergency C-section, all of which I delivered naturally without any complications related to my previous C-section. Now, I would like to tell you about the vaginal birth after a cesarean section. Sometimes a cesarean section is necessary in certain cases, such as when labor fails to progress, when there is concern for the baby, such as growth restriction or heart rate issues during labor, issues with the placenta, a very large baby, a breech presentation, or when infection or illness such as HIV or genital herpes could be passed to the baby during a vaginal birth. My beautiful women, if there are complications and the only way to save you and your baby is a cesarean section, please do not say no. Many women have lost their lives and babies this way. A C-section does not make a woman worse. I've heard some women call those who have a C-section lazy and cheaters because they do not give birth naturally. A C-section does not make any woman less of a mother, nor does it make her a lazy mom. A C-section is a major surgical procedure that can cause more complications for you than a vaginal birth. For example, your incision or the cut, uterus, and other parts of your body, such as your abdomen and bladder, can become infected. You may lose a lot of blood and need a transfusion. Some women and their babies have even lost their lives in the process. A C-section is not as easy as people make it out to be. I have gone through it, so I know. If you are pregnant again and your last baby arrived via C-section, you may wonder if a vaginal birth could be an option for you this time around. A vaginal birth after C-section is possible for many women, but there are factors to help you and your doctor decide if it is right for you. Safety for you and your baby is the main thing to consider. VBAC isn't always safe for every woman. If you try to have a vaginal birth and you are at high risk of complications, it can cause serious problems for you and your baby, some even life-threatening. That's why it's important to talk to your doctor about the risks. Your doctor may suggest that VBAC is too risky for you to succeed at vaginal birth. Risk could include any of the following. Number 1, obesity. Your body mass index is 30 or higher. Another one is preeclampsia, high blood pressure during pregnancy. Another factor is age, usually older than 35. Another factor is your previous cesarean was in the last 19 months, or the fetus is very large. Previous C-section scar. One crucial detail that you and your doctor must discuss is the type of C-section scar that you have on your uterus. This may be the same type of scar that you have on your abdomen, but it may go in a different direction. Doctors make incisions or cuts in the abdomen and uterus in 2 different directions during a C-section. Number 1 is a vertical cut goes down from top to bottom, and the second one is a transverse cut goes from side to side. If your C-section scar is vertical, you cannot attempt VBAC. There is a very high risk that your scar could rupture, burst open, or tear. When you try to have a vaginal birth, which could cause great harm to you and your baby, you will need to have a C-section again. If your C-section scar is low and transverse, your doctor might allow you to try a VBAC if your other risk factors are also low. The hospital matters. Check with your doctor early to find out if the hospital you are using allows women to attempt VBAC. Not every hospital does. Although the risk of your old scar rupturing during VBAC is low, the hospital must be prepared to handle the emergency that could arise if it does. Some hospitals simply aren't prepared to handle it. There is a very small chance for every woman who attempts VBAC that their uterus could rupture, even if they have a low transverse C-section scar and is in good health. Doctors can't be 100% certain whether or not it may happen to you. Even though ruptures happen in less than 1% of VBAC attempts, Some women don't want to try it at all because if it does occur, it can be very dangerous. You need to weigh your options and talk to your doctor before you decide what to do. How does labor and delivery during VBAC differ from labor and delivery during a routine vaginal birth? If you choose VBAC when you go into labor, you will follow a process similar to that used for any vaginal delivery. However, your healthcare provider would likely recommend continuous monitoring of your baby's heart rate and be prepared to do a repeat C-section if needed. If you are considering VBAC, discuss the option, your concerns and your expectations with your healthcare provider early in your pregnancy. Make sure he or she has your complete medical history, including records of your previous C-section and any other uterine procedures. Your healthcare provider might calculate the likelihood that you will have a successful VBAC. Also, plan to deliver your baby at a facility that is equipped to handle an emergency C-section. Continue discussing the risks and benefits of VBAC throughout pregnancy, especially if certain risk factors arise. Above all, try to stay flexible. The circumstances of your labor could make VBAC a clear choice, or after counseling, you and your healthcare provider might decide that a repeat C-section would be best after all. So who is eligible for VBAC? VBAC eligibility depends on many factors. For example, what type of uterine incision was used for the prior C-section? Most C-sections use a low transverse incision. Women who have had a low transverse or low vertical incision are usually VBAC candidates. If you have had a prior high vertical or classical incision, VBAC isn't recommended because of the risk of uterine rupture. Have you ever had a uterine rupture? If so, you are not a candidate for VBAC. Have you had other surgeries on your uterus? If you have had other uterine surgeries such as for fibroid removal, VBAC isn't recommended due to the risk of uterine rupture. Have you had previous vaginal deliveries? A vaginal delivery at least once before or after your prior C-section increases the probability of a successful VBAC. How many C-sections have you had? Many healthcare providers won't offer VBAC if you have had more than 2 prior C-sections. When did you last give birth? The risk of uterine rupture is higher if you attempt VBAC less than 19 months after your previous delivery. Do you have any health concerns that might affect a vaginal delivery? A C-section might be recommended if you have placenta problems, your baby is in an abnormal position, or you are carrying triplets or higher order multiples. When will you deliver the baby? Plan to deliver at a facility equipped to handle an emergency C-section. A home delivery isn't appropriate for VBAC. Will you need to be induced? Having labor induced decreases the likelihood of a successful VBAC. So what are the risks and benefits of VBAC? For most women, C-section carries greater risks than a vaginal delivery, but a repeat C-section significantly increases the risk of complications such as infection, injury to adjacent organs, abnormal implantation of the placenta, and placenta previa, in which the placenta completely or partially covers the cervix. Because this section becomes more risky with every subsequent surgery, you may want to consider VBAC, especially if you plan to have a large family. Uterine rupture is the main risk cited for VBACs. This is a tear in the wall of the uterus, and it often occurs at the site of a previous C-section incision. While uterine rupture is a potentially dangerous complication, it's rare. Most studies show that for women who have had one prior C-section with a low transverse or horizontal incision, the risk of uterine rupture is less than 1%. Why is the risk of uterine rupture important to consider? First, uterine risk carries the potential for serious consequences to the mother, including blood transfusion and hysterectomy. To control the bleeding, there is also a risk of serious injury or even death to the baby caused by decreased blood flow to the baby. Obviously, VBAC is an optimal delivery outcome, but a failed VBAC that results in an emergency C-section also is risky. It's important when considering VBAC to talk with your doctor about your risks and likelihood of a successful VBAC. In case you are wondering how you can increase your chances of a successful VBAC, Maintaining a healthy weight during a pregnancy, as well as addressing any emotional concerns relating to a previous birth experience, are important factors in creating a positive approach to birth. Good support in labor is essential and may affect the length of your labor, which in turn may affect which type of birth you actually have. It's important to consider who the best people are to nominate as birthing partners and what plans may be important to help you cope during labor. I will give you 6 tips for preparing for a successful VBAC. Number 1, time your VBAC wisely. If possible, give your body time to fully heal after surgery before becoming pregnant again. Most professionals agree that at least 19 months in between your cesarean birth and subsequent pregnancy is ample time to recover. By allowing time to pass, you not only give your bodily tissues time to probably heal, but also a chance for your mind to heal. Take the time to process your thoughts and emotions involved with your cesarean and come to peace with your birth and story. Talk to a loved one or counselor if you feel it will be helpful for your healing. Number 2, do your homework. Read as much as you can about VBACs. Find studies about VBAC research and educate yourself on what your care provider should be aware of. Be prepared to share what you also learn with your midwife or doctor. Number 3, learn about your cesarean. Unless your cesarean was an emergency, you most likely have a vertical or transverse scar. This is favorable as it puts you at a lower risk of uterine rupture during future birth. Another fact you should know about your cesarean is the type of suturing your uterus had, whether single or double layered. You can ask your cesarean doctor or contact the hospital and request your birth report if your uterus was sealed using a single layered suturing. You may not be able to birth with a midwife or outside of a hospital. But again, ask the providers in your area, as this is always changing. Number 4, take care of yourself. Treat your body with great tenderness throughout your first year after surgery. Use skin-safe oils to massage your scar and reduce scar tissue. Take vitamins and herbs that are shown as strengthen your uterus. Make sure they are stable. Drink plenty of water and exercise regularly to gain mental and physical stamina. Get outdoors often. Number 5, avoid medical induction. When at the end of your pregnancy, try your best to go into labor naturally. Medical inductions can increase your likelihood of a failed attempt at a VBAC, as they can put too much strain on your uterus. And my last tip is prepared for any outcome. Know that even with all your preparation, you cannot control the outcome of your birth. If you must have a repeat cesarean, know that you were informed and prepared to the best of your ability. Try not to view this as a failure. Know that you are an amazing woman who cares deeply for her child. My little advice to you, if you have already had a cesarean section and the hospital says you are eligible for a natural birth, go for it and do not be afraid. It will be peaceful. Even if the hospital tells you that you are not eligible, accept it in good faith. There is no reason to be shy. Mama, please wear your scar with pride and dignity. If this is your first pregnancy, take good care of yourself. Avoid stress and negativity and maintain a healthy weight. I wish you all the best. Always remember to consult your doctor first and don't forget to take good care of yourself. Thank you for watching. If you have any questions or comments, please leave them below. Thank you and hey pa.